Come on, come on, come on.
Good morning. So how are you doing today? My name is Leo. I'm an SPTA today. Your student physical therapy assistant. Your PT right now is finishing up on a little paperwork, so he asked me to come in here to show you how to get out of your wheelchair. You'll be here shortly, so you don't have to worry.
Okay. Would you tell your patient that their lead therapist is doing paperwork?
No.
Because
I
now
was just trying to
paperwork
Now
is more
you're not.
important for you, right? So
He's busy at the
your
moment.
your PT asked you to come and see you today.
Yes, we come see you.
Yeah.
So I'll be taking care of you. Today I'm going to educate you, and we're going to actually demonstrate how to get out of your wheelchair safely onto the edge of the bed. Is that okay?
Sure.
Is it okay if I do that for you?
Sure.
Alright, so first thing we want to make sure is that our wheels are facing forward. This is so we can lower our center of gravity and things will be more balanced. So we want to make sure that the brakes are on and the lift is on. So that's good. Now to make things a little bit easier, we're going to remove this. I'm going to put this over here. Yeah.
I didn't know
So
that
just-
came off.
So there's a little button right here. You just push it in, lift it up, and now you have access, so you have more freedom to move. And this will be a lot easier for you to transition. That way nothing gets in your way. You don't have to worry about slipping or snagging your clothes on something and potentially falling. Okay, so
Okay.
so how are we feeling? Are we in pain today? Was anything hurt? Legs? Nothing? Everything pretty good?
Yeah.
Okay. All right. Well, the first thing I'm going to do, I'm going to put this gait belt on you. The reason I'm doing this is for both of our safeties. I don't want you to fall down and hurt yourself potentially. And I want to make sure you're okay. I don't want to get in trouble. And it's kind of a rule we have here. So it's probably just going to be best to keep us both safe. So would that be okay if I put this on you? This is going to go right around here, kind of like a high-waisted belt.
Oh, what?
And that's not very fashionable, but it's very, very safe.
Yes, yes, you got it in pink, girl.
You look forward to it. Thank you, thank you. So, did you eat breakfast this morning?
Remember.
You know? Oh, no. I'm gonna assume that if you had a delicious breakfast, you would definitely remember that. But you're still feeling okay?
Yeah.
You're not dizzy? Just want to make sure. Make sure you have the strength. Breakfast is the most important meal of the day. That's a little loose, so we're gonna make it a little bit tighter. There we go.
Now, can you tighten it without taking it all the way out?
I could have, yes.
Okay. So is that going to save you time?
It will save me a few seconds, yes.
So if you need to secure this a little bit better, open the loop, pull it tight, and then keep it in there, right? Rather than take rather than take it in and out and in and out.
Right. And now we're gonna loop this around here, just to make sure it doesn't get in either of our way.
So you said you didn't know if you ate. So what is he doing because with that information?
She got Alzheimer's.
Yeah. That should tell him maybe cognitively I'm not totally
So he's
Maybe
watching-
aware.
You wouldn't go house nursing
Or he could read her
see her
chart.
last time.
No.
I'm also checking for verbal cues. If I see she's maybe a little hypoglycemic, so I know she hasn't eaten, I'll be able to
So
recognize
you're
her.
just watching her extra.
Maybe, so that's why I'm asking the questions, make sure she's coherent enough. I'm assuming she's probably gonna be a little weaker.
Maybe, if I don't remember. I
So-
could have eaten everything, I just.
You could, yeah, just don't remember, yes. I'm looking to see if she hasn't. I'm assuming she'll be more normal or more herself if she has eaten. Regardless, okay. So now, what we're going to do,
What are those?
these are my shoes. This is how I untie them, and this is how I tie them.
Like a kindergarten.
That's how everybody does their
So,
shoes. Do you still do that?
I still thought if you're acting or if you're seriously like touching.
You only got 30 minutes.
I'm entertaining, yes.
You still wear shoes?
So now we're gonna have to stand up. How comfortable do you feel with standing up?
I don't know.
No? Okay. Well, I'm going to help you. So the first thing I want you to do is we're gonna scoot our booty up to be a little closer to myself, okay? So I'm gonna hold you right here. Put your hands right here, your left one. And if you need to, push down on this hand and push yourself forward while scooting your booty up closer to the edge of the chair. Okay, there you go.
Is
So
this how you want them to scoot?
I do not. So I want you to lean forward while you're doing that. So I want you
Are
to
you
lean.
pulling on my?
Oh, no, just make sure I have contact
Yes,
with
you
you.
are.
I'm holding you. So,
Pulling on my involved arm?
you're. So he's a kid. Okay, so.
There we go.
So you're gonna lean forward while you push yourself, not
And
too
so-
far forward.
Okay, how are you gonna tactile cue me to?
I'll probably, you're gonna scoot this way or scoot with
There you
your
go.
booty down
Because
this way.
that's what you want to
To
move,
me.
right?
Quick.
So if you tactile cue
Then
me
you're probably
here.
gonna, well, that was to lean forward, but then to actually scoot.
Yes. Okay,
So
so
we're gonna,
remember those tactile cues, guys, right? If you want them to move their bottom forward, tell them to lean to the opposite side, and then you need tactile cue back here. You need to bring them forward, right? More effective than here, you will see some therapists go under there. I like to be here. Right?
okay, done.
Move forward.
So I'm trying to do, so we're gonna lean forward when we get up, and we're gonna scoot up right here with our booty. Just a little bit more, just a little bit. There, perfect. Now, you're gonna get your hand, we're gonna have it flat right here. What we're gonna try to do is you're gonna,
Can't do that.
is it uncomfortable?
That hurts.
Okay, what about right here? I know it's not as soft as this, but it could be a
That's
little bit.
better.
Okay, so on 3, we're gonna push down with our wrist. We're gonna use our legs, and we're gonna stand up straight, and we're not gonna walk or move, we're just gonna stand up. Okay?
Okay.
So we're gonna see how that goes.
Okay.
So I'm gonna count up 3. 1, 2, and 3. Stand. Okay. All right, so we were going to
I
stand.
didn't do it.
I know, that's okay. We're gonna work up to that. So for now, we're going to get out of the wheelchair with this little slide board. So because right now you're having a little difficulty standing, we're gonna make it a little easier, and we're gonna slide your booty on top of this, and you're gonna slide over onto the back. Okay?
Okay.
So the first thing I want you to do now, we're gonna kind of reverse what we were
I'm
doing.
gonna lay on this?
You're not gonna lay on it, you're gonna sit on it eventually.
Oh,
But the first thing we need to do is we're gonna scoot back our booty right here, and we're gonna scoot backwards. There you go, just a little bit more. Go ahead and use your hand to push up. Good, good. Now what I want you to do, I want you to lean this way, bringing your booty up just a little bit. There we go. Okay, we're gonna come back on. That's a little, how do I adjust this? Okay. Oh.
I can't go down anymore.
I'm all sweaty. All the pressure's on me.
Tech, get a towel, get a towel.
It's okay to be a towel.
Adam, you got one right there.
You good, bro? You good?
Who's got laundry?
Okay, hang on. Okay. So now we have this under your booty. What we're going to do is you're still going to push off this hand, and you're going to
Same.
slide your booty this way onto the slide board.
okay.
Okay? I'm going to be helping you. Now, what you do not want to do is put your fingers underneath here. What could happen is when you slide your booty over, it'll shift away, and you could actually crush your fingers. So you always want to have your fingers on top. There you go,
Okay.
just like that. All right, so on 3, we're going to push down, and we're going to slide our booty this way, to your right.
Okay.
Okay? 1, 2, and 3. There you go, good, good. So we're going to try to go a little bit further. On 3 again. 1, 2, and 3. Good, good. So we're going to put your hand right here now. Go ahead and put your right hand closer over here. There we go. On 3, we're going to slide.
Oh no! No!
Oh, I didn't see your finger. You're not supposed to. Now remember what I told you, they don't go underneath. So on 3, we're going to transfer, we're going to slide one more time. 1, 2, and 3. There we go. Now we're almost there. We have one more to go. How do you feel?
Okay.
Okay, so I
trying to
got
get
you. I'm not
hurt.
gonna lean back. We're gonna slide one more time to right here, and then we're gonna be done. Okay.
Okay.
So on 3, 1, 2, and 3.
Whoa.
Oh, okay. We're gonna try that one more time. All right, 1, 2, and 3. There you go. And now we can slide
They're
a
gonna
little bit.
do that. They're gonna grab right onto you, whatever they can get. Okay?
All right. And that is how we use the slide board to get out of the wheelchair onto your edge of bed. How you feel?
I don't know.
Was that difficult? Was it?
Yeah.
Well, I think you did very good today, and we just proved that something difficult you can do actually. Okay. So I'm gonna let the teacher know the progress we made,
Okay,
And then, we're gonna see you next week, okay?
okay,
Thank you and have a great day.
okay.
Do you?
I'll go back.
Okay.
Okay. Would you leave me sitting there?
No, I would not leave you sitting there.
I'm going to that.